So welcome, Dr. Hilu, everybody. Just say hi. So happy you're on here.
I'm sorry I'm not there personally. I would have loved to be there with you.
We would have loved for you to be with us here personally. Yes. But we're going to reschedule. And so we're not like canceling indefinitely. We're just postponing. And we've just
until they allow us.
That's right. And we've just decided that it's going to be even better than what it would have been, right?
True. I will stay for more days so that I can chat with patients, with fellow doctors, with people who are interested in asking things, whatever. So we will compensate for it.
Yes. Okay.
Make up for it.
That's right. That's right. So everybody right now, I don't know if you can see on your screen, but everyone's saying hello. They're excited. I have Katie, who, you know, my assistant. So she's going to be answering questions too. And if Christina wants to help in, because you and I are just going to be talking. All right. So I say we just get started. And I just kind of was telling them that the COVID-19, also known as the coronavirus, has now become a global pandemic. And there's been a lot of things swirling with this as far as, you know, realities, fears, truths. And I just want you and I, because I know that we come together to bring, you know, truth and facts and not fear and causing stress, because you and I are all about no stress.
Exactly. In fact, it's one of the ways to prevent. We'll talk about it later.
We're going to talk about it. That's right. That's right. And you've taught me so well on this. I'm not as well in it as you, working on it, but I'm getting there. And so what I was trying to convey to our followers and to everyone that is listening is that we just want to be the source of hope. We want to be a source of information. We want to, and then also give them resources and tools from what you're going to let us know what we can do to be prevented in this, because I'm like, this is probably not going to be the only virus in the rest of our lifetime that is going to come up. And I thought about, you know, I wrote a chapter in my book, I Am Resilient, which I know you read, about being in the training ground. And so I just think this is a great time to talk about what's currently happening, but also how can we prepare ourselves for, you know, long term, as we walk out our life on this earth. We're going to have these things come up. But I feel that it's our response and how we respond to these things determines a lot of how we can overcome them, whether or not we get it or not, or however. So I'm going to just kind of ask you some questions. And so let's just start. And the first one is just what exactly is the COVID-19? What exactly is the coronavirus? And if you can just talk a little bit about that, that'd be wonderful.
Practically all viruses are similar. The common denominator of viruses is that they don't live on their own. In fact, a virus cannot survive on its own. It needs a living cell in order to be able to function. So outside a body, it can last for a very, very short while, and then it'll become inert, inactive. It needs to penetrate into a cell, and then it starts stealing energy from the cell. It doesn't even eat. It doesn't need food. It doesn't need nutrients. It's a very peculiar structure. And the virus we're talking about, the COVID-19, it's number 19 because of the year 2019. It doesn't mean anything else. Okay. The coronavirus has been in existence for many, many years, probably since 1962. You have different families. I think it's 38 different coronaviruses classified in 4 groups. You have the alpha, the beta, gamma, and delta, until it infected the 0 patient in China last year. The other peculiarity of this coronavirus is its size. It's bigger than any other known one in that family, in RNA viruses.
Okay.
It has sort of a sheath of protein that surrounds it. And from now on, what we are going to be discussing would be applicable to practically all the viruses.
Okay, it's good. That's really good. Thank you. And so for you, those of you that are just joining us, coming on here, we are talking with Dr. Raymond Hilu, the leading cellular biologist in the world, who is giving us information on the coronavirus, educating us, teaching us, and then he's going to give us some practical solutions for not only this virus, but for all viruses. So here's my second question for you. What exactly does the coronavirus do within our bodies? And I know you started talking a little bit about the difference as far as like the size, but any different from the regular flu, the past flu virus outbreaks that we've had?
What it does is the following. As I've just mentioned, it needs our cells in order to be functional. So it penetrates into the cell, and as soon as it's inside, there's energy for it to function. That's when it starts to replicate itself. And if it manages to replicate itself many times, then it starts destroying the cell, the cells, the tissue, organs, and the organism, and can even cause death if nothing stops it. So I would imagine that one of your questions would be, how can we avoid this from happening? What to do if we have it? But the way it goes is like this.
Okay.
It goes in, starts growing in the body until it overcomes the body.
Okay. And would you say that that is pretty much conducive for all viruses? And
yeah, yes. In fact, it's even less mortal than the normal flu virus.
Okay. So do you want to talk a little bit about that?
Yeah, rate of mortality is less.
Okay.
So far, as far as we know, there isn't much information available. I've been talking to one of my friends who is a virologist. He only studies viruses, and he didn't know much because it hasn't been studied in depth so far. But all the viruses that have been studied so far behave very, very, very similarly.
Okay. So there's a great question right here. Someone's saying, so then why so much panic is taking place right now all over the world with this?
Well, this is a very difficult question to answer. The medical questions I will answer very, very easily.
Okay.
But this is more of a social situation question, and I'm not very good at that. People enter into panic very easily. Okay. Yeah, maybe there's one reason. There's one medical reason why.
Okay.
The difference between this virus and the flu virus is that it's not panicky because it's more mortal or lethal. It causes panic because it is more contagious.
Okay.
So you can catch it quicker than the flu virus. Just being like 3 inches, 4 inches away from someone and getting any liquid from that person, from a cough, from sneeze, it's on you.
Okay.
Because it's the saliva that comes out from our mouth. It's classified in 3 types of density. The small density, which is the one that goes furthest. The medium density, that's where the coronavirus stays.
Okay.
I think measures 0.12 microns. And then the heavy virus that you have to kiss the person in order to get it. So the coronavirus falls like about a meter away when you spit or cough or something. So it's quite easy to catch.
Okay.
And it spreads very quickly. That's why people are afraid. And I think there's a second reason why people are afraid. I think people in the back of their minds, they think that no matter what is done, it's not going to work to stop it from spreading. Why? Because in order to stop it from spreading, 7,000 million people have to be obedient. This will never happen because you and I, everybody, knows of people that are not obedient, that don't follow common sense, that we can even say they are stupid. Let me give you some examples.
Okay.
There are people who know that if you drive your car whilst you are drunk, you can kill somebody else. It's dangerous.
Yes.
Should they be doing it? No. But there are still people who are doing this. In the same way, people know that being on drugs and smoking and bad life can destroy their health. They still do it. So there will still be people, no matter what the political leaders and the doctors say, stay at home, use this, use that. They're not going to listen. They don't care. They don't respect life. They don't respect their own life, and they don't respect the life of others. That's why in the back of our minds, we all think one way or another, okay, I'm doing it properly, but what about all the others?
Right.
So if not everybody does it, it's going to escape. It's going to survive, and it's going to become one more virus on the list of the viruses that are surrounding us, and they stay with us. And maybe that's why people are panicking.
That's good. And it's true. That is so true. I love when you give these analogies, because it just hits right home and everybody can relate, and it's so true. So hopefully there will also be some people today that won't go drink and drive. Okay. On to my next question. You know I love you. You know that I always got something to say. Okay. All right. So talking about where did this coronavirus come from, you pretty much answered that in your opening. Is there anything else you would want to say about that as far as the origin of that? Or, I mean, obviously.
Well, yeah, well, although it's not very important whether it came from China, from Singapore, or it's related to the one that appeared in Saudi Arabia in the year 2012, it doesn't make any difference in reality.
Okay.
But yeah, maybe one more hint, because coronavirus has existed for many, many years. Why is it that we are getting it now on us?
That was my next question. Why are we just hearing about it now, and why is it just coming upon us now?
Because now we travel more, there's more globalization, everybody is everywhere all the time, people move all over, Chinese people come to Europe, fly to the States, people from Singapore come to us, we go everywhere. So 100 years ago, or even 50 years ago, this was not happening.
That's true.
So it could have been because of this, because everybody is everywhere.
Gotcha. That's good. Okay. So what are the most common ways people can get it? I know you just talked about the saliva and being within proximity of like 3 or 4 inches, but what are some other common ways that people can get this?
There are not many ways you get it. You have either to get in touch with human fluids directly, or get in touch with such fluids indirectly. There are no other ways. The directly is the face-to-face. The indirectly are the surfaces wherein an infected person has left some of his or her viruses on that surface. You touch the surface with your hand without knowing. It can be a door, a table, a computer, a cell phone, can be anything. And you don't think of coronavirus when you're doing that. And then you touch your eye, your nose, your mouth, and then you get it. If this happens within the first few hours of after having contaminated the surface, if you touch it within the first few hours, we don't know how many. Some experts say 12 hours, others say 2 hours, and some say 12 minutes. But if it happens at the beginning, when it's a fresh virus pool in existence there, and you are touching it, and you touch yourself, then you may catch this virus.
Okay. All right. And do you know, like, what are the most common, like the early onset symptoms or things that we should be looking for?
Yes, the symptoms are very clear. And not always you get the three of them,
Okay.
but if you get two of the three, then very likely you may be having the infection. But most people get the three.
Okay.
The three are fever, even a few decimals would suffice to indicate this possible problem. A dry cough, not a cough with mucus. A cough with mucus is not coronavirus.
Okay.
So if you're coughing and you have mucus, then it's not corona.
Okay.
And breathing insufficiency or trouble or problems or tightness.
Okay. That's interesting. Okay. I don't know that I've actually heard it like that. So thank you for sharing that. All right. So what do we do? What can we do if we or someone we know get it? What are our options? Obviously being tested and.
Do you mean to prevent?
Not so much to prevent,
it?
but if we now think that we have it, if we think that if we having those 2 out of 3 symptoms or all 3, what should be our next step?
Right. Depending on what country you live,
okay,
the steps to follow would be different.
Okay.
Because some countries are so burnt out, and their hospitalization system is so overloaded that you should do it one way. Other countries are still on the low contamination level, as it were, and you can behave differently. Let me talk to you about Spain, because that's what
okay.
I know. I have got no idea what's happening there. Here in Spain, they started at the beginning saying that people who have symptoms should call 112. Shouldn't go to hospital, because if you go to hospital, you will be contagious to everybody there. So stay at home, call the hospital, and the medical information telephone number, and they will ask you a few questions. And depending on how you answer, they will determine whether it is coronavirus or not. If they consider that it could be, then they will send a medical unit to your house, to your home, and take care of the situation. But this doesn't function like this in Spain anymore, because this telephone number is overloaded with phone calls.
Yeah.
So they are setting up new telephone numbers, and every few hours we have a new telephone number to call, and an alternative one, and another one, and almost all of them are overloaded.
Wow.
So first would be to contact medical services.
Okay.
Number 2, if there's somebody else living with you, there are many things that you have to be careful with. Keep a distance, even if it's your wife, your husband. Don't be physically loving. Just be emotionally loving, but maintain
emotionally loving.
Yes. Use a mask, but it has to be a proper mask. There are, I think, 6 or 7. There are 6 or 7 types of masks.
Okay.
The mask that I use, for instance, in the operating theater, this is useless for coronavirus.
Okay.
Because the pores that it has are much larger than the diameter of the virus. So it's going to go through. I think there's only 2. The 2 best are the ones that are 0.02 microns in porosity, and there's another one that's 0.04 or 0.06, which still would be good, because coronavirus is 0.12 microns. So we have to investigate or ask, what's the porosity of the mask?
That's good.
And this way, we're not protecting ourselves, we are protecting the others that are with us.
Yeah, that's so good. Thank you. All right. And people were asking, do masks work? So I'm thankful that you answered that. All right. My next question is, So now let's talk about prevention. We've now understand. This is my
This
favorite.
is my favorite.
This is my favorite. Like, I understand all that, but let's end this on like a really happy note, positive, and because there's a lot of things. We're resilient. We can overcome, and we want to prepare. And I know that just as you are, this is why I love you so much, and you've helped me through, you know, so much in my life and my health journey, is being prepared and being preventative. And I've learned that fighting for my life from chaos and sickness is really not the best place to be, but fighting for my health and rest and peace and clarity and, you know, prevention is the key. So what can we do to help prevent this? I want to talk about within our bodies, because I want to talk about the environment that we have within us. You know, we've been talking about the environment around us and, you know, how to prevent that, but what we can do internally as well as externally to be, to help prevent this.
All right. I'll talk about prevention. And if you want, and if we have time, we can talk about how to treat the condition if you are already declared positive. Not that you have a doubt, but you are certified positive.
Yes. Do you want to start with that one?
Treatment, is that, shall I start with this one and finish off with the prevention?
Yes.
Okay. Okay. There are sort of natural supplements that can help. We cannot say that a natural supplement cures.
True.
Legally, we cannot say it.
True.
There are natural supplements that help deal with the situation.
Okay.
Right? One of them is an amino acid called L-lysine.
No, that
it is used a lot in herpes virus with very, very good results. But since viruses behave very similarly, so that could be something to use. Not to use preventively. We're not talking about prevention. That's if you have it. If you don't have it, L-lysine will be useless in this case. So all that I'm going to be talking about now is useless for prevention. This is to treat.
Yes.
There are some countries, China, for instance, has approved the vitamin C IV treatment to destroy the virus.
Yes, they have.
They have. It's 45 grams that they put in the serum, in the drip, and it has proven to work. In fact, now some...
Oh, you froze up. Hold on. There you go.
Somebody has been calling and are traveling to Europe to help European doctors deal with the situation because they have more experience. They have dealt with many, many cases. Another powerful tool is ozone IV. Very, very powerful. There is yet another one, and then I have to explain a little bit so that everybody understands why this other one would work. And it's also IV. It's bicarbonate IV.
Bicarbonate, yes.
In some countries, you can get it. In Spain, you can get it. You can go to a pharmacy and buy a serum which is alkalized with bicarbonate. Now, why bicarbonate? Because vitamin C burns the virus. Ozone, because of the oxygen destroys, of the reactive oxygen destroys the virus. But bicarbonate is different. Viruses can survive very, very easily in acid atmosphere. This will be linked later to the prevention. But if the medium is alkaline, cannot survive. So you can't do this at home. It has to be a qualified medical doctor that has, because if your blood is already out of order as far as pH is concerned, some of these therapies would be even harmful for you. So it cannot be done just like that.
Correct.
So IV with bicarbonate is another way to do it. More things that can help. Hyperthermia. Systemic hyperthermia, i.e. elevating the temperature of the whole body artificially, like imitating fever.
Yes.
I'm not talking about just the standard sauna.
Okay.
I'm talking about the medical hyperthermia, wherein you induce artificial fever. When you induce artificial fever, the immune system is starting to work, and you are starting to destroy the virus at the same time. So you're doing a 2-in-1. Very, very effective method. Not everybody can tolerate this high temperature for 1 hour, 1 hour and a half, especially if the person is claustrophobic. You know the machine, you have seen it.
Yes.
So it's the German one that you saw downstairs.
Yes.
More things that can help. Supplements, and this again will be an intersection with the prevention, supplements that can improve the quality of the immune system. So I'm not going to discuss them now, since we are going to discuss them with prevention, because yes, we can prevent by having a good immune system.
Yes.
We think this is common sense. And we need, I think nobody has discussed this so far. I've been looking at different interviews and specialists. Let's say that now I have the coronavirus. Okay, and I'm treating myself and I'm using the mask. And now I'm cured. But I don't know that I'm cured. It's the day after, and I'm cured. And then I use the same mask again. Oh. What will happen to me?
You're going to get reinfected. It's
okay. What about I reutilize my toothbrush again?
Ah, yes.
What about if I reutilize my shaving kit?
Your razors, again? Yes.
Razors. My sponge for the shower again.
Yes.
Or my whatever again for intimate hygiene.
Yes.
So we should use disposable material.
That's so good.
If we are infected. That's not prevention.
Right.
In case of infection, everything disposable, and it goes to the bin every single day. Yes. If not, we are going to reinfect ourselves. This is very, very important. It's not only important for coronavirus, by the way. I think people should take good note of that. It's applicable for herpes, for just standard flu, for any other viral infection. In fact, it's applicable to any infection. If you've had an infectious disease and you get back to using your personal items again, you're in trouble. Probably you are in trouble. If your immune system hasn't built up all that well, you'll get it again.
When I was younger, whenever I got sick, I thought I would always say as a little girl, that is so yucky. I'm not using my toothbrush or anything else again. Mom, get me a new one. So look, even though I didn't know, I knew. See?
Yeah. That's good intuition. Yeah. Since you were a little girl, there you are.
That's right.
Yeah. So these are the things that we have so far, because the methods that have been tested in some hospitals, maybe there's been 1 or 2 success cases wherein they used retrovirals, antivirals that are used for AIDS, and in 1 or 2 cases it worked, but it's not really like that, because the coronavirus behaves very differently to the HIV. So this is as far as I know so far. Sure.
Yes. Before we keep going, because people are asking, what Dr. Hilu is talking about right now is not about the preventative part of it. He's talking about if somebody actually is infected with coronavirus, because a lot of people are like, so every time we need to change our toothbrush. We're talking about if you've been infected by the virus, or any other viruses for that matter, is what he's saying, is that we should be using disposable things, razors, toothbrushes, brushes, body brush, anything like that.
Yeah.
That we're using. So we're not talking right now. We're going to get to prevention. Right now, we're talking about if you have been infected by this virus or any other virus.
Or even fungus or bacteria or anything.
Okay.
Any infection, disposable material for your hygiene.
And someone's asking, how long would you be using these disposable materials post-virus once you were clear? Like to then...
Right. Then you have to get a blood test.
Okay.
In Spain, we call it PCR. I think in the States, you call it CRP.
Okay.
It's a protein reactive chain test.
Okay.
And this protein is manufactured in the liver, and the liver makes more of it when there's a lot of production of cytokines, which are produced due to the abnormal activity of the immune system when you have different strange conditions. It can be inflammation, but it happens also when there's coronavirus.
Okay.
So if it exceeds the reading of 5, and you've been controlled by doctors and it's been over 5 all the time, and then all of a sudden it drops to 1 or to 2, then you are cured. That's the method they use in hospitals to determine whether you are clear from the virus or not. Well, when this happens, throwing things away, I mean.
Okay, wonderful. So that is amazing. It's what I love about being in Spain and having all of these treatments available. We need them all here.
Sorry.
I know. We're praying and working hard. Eventually, one day, I declare, we will have this available in the United States.
Oh, yes.
All right.
I'm sure of that.
All right. So, are we ready to move on to prevention?
Yes.
Okay.
Basic things that everybody knows is the washing of hands.
Yes.
But it's not open tab, get some water running, do this, and that's it. No.
Correct.
Soap and water, preferably hot water.
Okay.
And preferably 3/4 of a minute, not a few seconds.
Okay.
And then don't use a dirty towel to dry your hands, either an air dryer or a disposable tissue.
Okay.
That's one. Avoid large crowds.
Okay.
This is also something that is being said to everybody.
Yes.
Avoid cold homes, low temperatures at home, and cold drinks. They make it easier for your body to get infected.
Wow.
Okay? When you sleep, when you go in bed, that's 8 hours sleeping, your body temperature may drop. So that's probably when you have to keep warm, even wearing socks if needed.
Okay.
If you sweat, it's no big deal. The following morning, you just get a shower and that's it. If you are really very worried about it.
Okay.
What I'm going to say will make people laugh, but it's not a joke.
Okay.
Don't get old.
You tell me this all the time, so I love it.
Because if you get old, you become of the group of the risk of higher risk.
Yes.
Could that be done? Yes, it can be done. You cannot avoid death, but you can avoid aging unnecessarily. And it still goes along what we're talking about, like eating healthy. If you don't eat healthy, your body is not going to get the nutrients in order for your immune system to be strong.
Yes.
That's one. Another important thing to prevent, drink lots of water.
Yes.
Another important thing, avoid acidifying food. Just remember what we've mentioned about bicarbonate before.
Yep.
And one of the most acid forming, I wouldn't even call it food. I wouldn't call it food, but people consume it, is sugar.
Yes.
So sugar should disappear from your diet as one more tool to prevent. It's one more. I mean, if you just stop eating sweets, you're not going to be preventing yourself from getting coronavirus, but that's another one to add to the list. Something else, sleep at least 8 hours. Now, I want to stop here and explain a little bit.
Okay.
The human body manufactures and optimizes the immune system when we are in parasympathetic situation, i.e. when we are resting.
Yes.
The deeper and the better we rest, the better immune system we will have the following morning. Mm-hmm. So although it sounds like not a big deal, it is very important if we are worried about the possibility of catching the virus.
Yes.
And in the same way, it will make you older if you don't sleep enough internally. The same is true about stress. In fact, stress destroys the immune system.
Yes.
If you are nervous and stressed, you are multiplying your chances of catching the coronavirus probably by 10.
Wow.
So you have to reset your mind. Smile. It's difficult for me. I don't know. I have a strange face. Smile a lot, even if you have to put a pencil in your mouth to help you do that. Get somebody to tickle you, to tell you jokes. Be happy, relax. Don't fight, don't argue. I keep writing these notes to my patients, in fact, all the time, because all different health conditions are aggravated by this tiny little issue that people think, I'm like this. This is my personality. I can't change. This is a big lie. It's a big excuse, and it's pride.
Yes.
If you say you can't change, it's because you are proud of the way you are. And if you are proud the way you are in trouble. Yes. So you have to be humble, very humble there, and make changes to save our lives. In fact, that's what we're talking about. Yes. And then another thing to prevent is maintain a high quality gut health.
Okay. Yes.
A large part of the immune system is manufactured in the gut.
Correct.
So that's another issue. And again, we're talking about good nutrition. No junk food. No visiting hospitals.
Okay.
Where there are more possibilities of being infected. Again, now I'm going to say something offensive, but it's true.
Say it. But you froze up.
Unless you protect yourself very, very well, because they are the largest risk group. 95% of the people who died from coronavirus in Spain were elderly.
Yes.
So I know it's not nice to hear, but.
Can you repeat it? Because you cut out for a second. So can you repeat that again?
Don't visit elderly people, even if they were your family members, unless you are properly protected. Okay. Elderly people are the highest risk group. I mean, if you and I need to apply 2 or 3 of these things, elderly people would have to apply all of them.
Yes.
Without exception. And they still would be in risk.
Correct.
So unless it's necessary, don't visit them. And if we visit them, get our mask, be careful, don't kiss them, don't hug them, even if you feel like doing it, at least until this psychosis disappears.
Okay,
and just one more thing.
Okay, sure.
And we'll be done with all the different prevention tools. Take supplements that make your immune system stronger. Okay. Which would be arabinogalactans, for instance, are very helpful. We have transfer factors that can be helpful as well. There are many things. I mean, I have no idea what's availability in the US regarding supplements, but you tell them then. I know what's here in Spain. We use NK Vital Fifa, which is very, very powerful, but it doesn't exist in the States. Right. So whatever is available there and whatever you can tell people, because you are an expert in this field, just give them a list of supplements that can make them get a better immune system. Okay.
So one of the questions, all right, so before we do have a little bit more time. So one of the questions that's real important. What about pregnant women? Is there anything in addition that you can tell them? Because I'm seeing that a lot on here. And then we have a lot of doctors, a lot of people, health practitioners that are actually on here. They're saying, okay, we're doctors, we're nurses, we're dentists, is there anything else we can be doing that maybe we're not doing right now?
Yeah, the ones like myself and other companions that are exposed, because when people visit us, we don't know if they have the virus or not. And normally people who visit us are people who are not really enjoying good health. So there's higher possibility that we get infected. So in our case, although people to prevent don't need to use the mask nor gloves, in our case, we would do that.
Okay.
We would keep even a more distant more meters, more inches of separation between the patient and us, and again behave as if we were elderly.
Okay.
Do it all. Eat better than ever. Drink more water than ever. Avoid all these things that have already been mentioned. Work on our immune system. Instead of sleeping 6 hours, sleep 9. Don't fight even with the cat. I mean, be exaggerated.
No, yeah, exactly. And then what about for women that are pregnant?
Well, it's the same. Pregnancy does not increase risk factor. In fact, diabetic people have much higher risk situation than a pregnant woman. But again, since they have a second responsibility,
just
more prevention. Nothing specific.
Okay. And so the same thing, whether you're a dentist, whether you're working in the ER, anything, just do all of these things. Sleep more, eat better, remove the foods that produce more acidity in the body, no arguments, get all of that. So I hope everyone's hearing that, because they keep asking, well, what about this kind of person? What about that? It's like kind of like across the board. And I wanted to see, let me see if I have one more question. But on that, let's just talk about, I am huge advocate about emotions and how, and I know that you and I have talked about this a lot. I love how you've shared with me that, you know, around 9 times out of 10, an emotion is also driving a disease. And we always talk a lot about them, but it's like, we know that what we've been talking about, we truly are, we are a society that is in burden of toxicity of all sorts. So from the layer, if we look at it as layers, from the processed foods, the chemicals in foods, then we're layering on the pollution, the air we breathe, exposure to like ambient noise pollution, and so things that are related to our metabolic health, levels of inflammation, things like that. You've talked about heavy metal overexposure, age, when you just mentioned about age. And so I understand that the body has like it has an adept to overcome things. You know, it's not like if you have an exposure to just heavy metals that we're going to die. I get that it's multiple things. And
it's
so so I love how we're going over all of these different things. And we know that the body obviously operates in balance and homeostasis. And then the way that it rebalances itself, you know, in allostasis, I know these are funny words for people, but it's just all of these things of prevention that I love, because I feel that if we apply all of these things, then we're not only protecting ourselves from, say, the coronavirus, other viruses, but also for disease that can happen later down the road. Now, I know that you've also talked about how, and I don't want to get too much into this because I want to save this for the conference, but I just people want to know about the blood tests that you do. And what I love about it is we want to be able to not over medicate or over supplement. But in this situation, you're talking about specific things that we can do to prevent. Now, we can take supplements all day long, but if we're not getting our sleep, washing our hands, eating good food, taking out the things that are feeding and opening up the door for disease, we need to implement all of these things. Mm-hmm. So can you just talk a little bit about emotions? Because right now, fear is the driving emotion. And to me, I feel like that's suppressing our immune system and a lot. And how does that look in the blood? But if people are concerned about where the state of their bodies are internally, the environment inside, what is the Hilu method? What is the thing that I know I've been talking about, a lot of people have done, but talk about the blood test really quick and what it is you can do and help people if they're concerned, or if they're like, I don't know where the state of my my gut is, or anything like that, or my liver, or what can I do?
When somebody is overstressed, their body produces corticosteroids. And the effect of the corticosteroids on the blood, we can see it when I look at the blood under the microscope. But the interesting thing is, and this connects us again with the prevention of the coronavirus, the corticosteroids can provoke, in fact, it does provoke paralysis to the immune system.
Yeah.
It stops it from functioning. So it's not a matter of just, it's like a feeling that can make you feel poorly and then you can get ill because you think you are going to get ill. We're not talking about thoughts. We are talking about biochemistry.
Yes.
The body translates everything into biochemistry. So whatever happens to you, whatever you think, even whatever you read, is translated into substance in your blood.
So good, so good.
And what we try to do all the time is read as many things as possible in this blood to see what's going on in the wrong direction and start giving people specific advice of what to do to correct such tendencies. So it's not a matter of just how many white cells or how many red cells or how many platelets we are having in our blood. This is not what we look at. In fact, for that, you can go to any lab and they give you the results in half an hour. What we look at are substances that should be there, substances that shouldn't be there, and if they are or not, it's going to affect your health. And we want to correct this. So this is all the blood kit, the smear blood analysis is all about.
And so, and people get it a little bit confused, which I did a long time ago, was the difference between live blood analysis and the smear analysis. Is there any, is there?
I don't use, in fact, the live blood analysis. A live blood analysis is when you look at the blood when it's alive. Mm-hmm. That's all it means.
Okay.
The way we examine the blood, because we have many, many years of experience, we don't care if it's alive or not, because we are able to do forensic testing. So we know how it was when it was alive, when we look at it a few days later and it's not alive anymore. So that's why we use a different term. We use blood smear analysis, just to be more precise. But it is like the live blood, but again, we use different lenses, different filters, different microscope, and the know-how, of course.
The microscope that you created, that only you have, and that's why I tell people, it's, I mean, and I love that, because I remember we had a discussion not too long ago, and I'm like, I have the hardest time talking about this being alternative healthcare, because this is like the way. This is healthcare, prevention, real healthcare, not sick care.
I wouldn't even call it alternative, because everything's valid. I'll call it very complementary. I mean, people can do all sorts of things. They're free to do whatever they want, to decide whatever they want to do with their life. Yes. And they can complement this because it has no contraindications. It doesn't have to substitute anything else. They can complement it. They can add to it.
So good.
A healthy life that is suggested to them by someone who knows what they're talking about, if they want to listen. That's all it is.
Exactly. So people are asking, all you have to do is, you can actually go to our website, AndreaThompson.org, and we provide the blood test kits that Dr. Hilu has. So you can go on my website and look for that, and we'll post all that. But we still have a few more minutes. Is there anything else that you want to, okay, so for vitamin C, people are like, can we take a vitamin C supplement as opposed to doing the IV? And if so, what would be a liposomal be a better bioavailability? What would you recommend?
Yes, if IV is, you're talking in case they had the coronavirus or for prevention?
Prevention.
For prevention, you don't need the IV. IV is not for prevention.
Okay, and
it's
so
to treat.
yes.
So in supplement form, yes, of course, because vitamin C or very good juices like the ones you prepare, you take, that are rich in vitamin C would do the job. Okay. Vitamin C is excellent for the immune system, so that can be a good alternative. But not. It's good that you brought up this point. I want to make sure I mention this. There's one supplement in the American market that in some cases can help. In other cases, it can have an opposite effect. We see that when we look at the blood. Yes. So you cannot take it unless, my opinion, instructed by your doctor or somebody who's helping you in that. And it's called cat's claw. Oh, yes, yes. Cat's claw can be good for your immune system, depending how everything else is. Okay. So don't take it freely. Okay. Vitamin C, almost always you can take it freely. Arabinogalactans, almost everybody can take it freely. But cat's claw, be careful. And do you have I hear such conflicting information about how much vitamin C a person should take. So do you have any recommendations on that? Well, you have the FDA recommendation, which is very, very, very low. Yes. Extremely low. So it's not enough. I would say about 2 grams for 1 gram for every 100 pounds of weight. That's okay. It. All right. And what I wanted to hit home on this really quick to just let our listeners know, because we're gonna be ending here in a moment. So first of all, thank you so much for your time. Thank you for your patience with me. Now you know that I just came off of the liver cleanse, so my brain and the time and all that. But no, this is not the problem. You don't have such a nice watch as the one I have. I know. That's the problem. See, I don't have any. That's my problem. I need a good watch. Yes. You know, a fun one like you have. Exactly. So just a couple things really quick. We're going to be postponing. We're going to be rescheduling the conference. We'll know more as, you know, the government, everyone comes together and lets us know about the travel issues, and then we can figure that out. But you definitely have said that you would make sure that you would get back out here. And thank you so much for your time. It's Saturday. You didn't have to do this for any of us. So I just so appreciate you and have a lot of just gratitude in my heart for you. And I know, Christina, I did it for you. You did it for me? Yes. Thank you. Thank you. And I know you won't do anything unless you want to. So I really, you know, I feel honored. And thank you to Christina and Ivan, I'm sure are probably around there. Yeah, they're around here. Yes. I'm thanking them. They say hello to you. And I guess I'm probably going to see you probably before you come here, because I'll be coming there soon, as long as that all works. If the flight is still allowed. That's right. Then I'll see you in May, which will be exciting. And people, again, if anyone's concerned, I just want to hit on this one thing really fast. You talked about things like the vitamin C or like the ozone, and it can actually have the reverse effect where it can actually cause more oxidation than bringing in healthy oxygen, things like that. Yeah. So this is why I always tell people it's so important to get the blood tested by you, so that we can see that, because things that we deem healthy and good for us, depending on the environment and the condition inside of us, is going to determine how these things will actually affect us, right? Yeah, let me just underline quickly what you're saying. For instance, when we use in our clinics IV with ozone, before doing that, we make a blood test, a specific blood test, to check oxidative level. Yes. And depending on the reading, we adjust the dosage. If not, we can harm the person. That's right. Things have to be done always tailor-made when it comes to treatment. When it comes to prevention, all that we have said, everybody can do it. But when it comes to treatment, under health care, somebody who guides you, unless you are a doctor yourself.
Yes. Awesome. That's what I wanted to end with. So please share this. This will be up for 24 hours and we'll make arrangements to possibly put it other places. But for right now, it'll be up for 24 hours so anybody can go see it. I'm looking at, we have literally over 600 people right now on here live, which is wonderful. And I'm hoping that they share this wonderful information and everyone could just take a deep breath, come back in the parasympathetic dominant state of relaxation, and rest.
So let's hope that these 600 not infected will infect everyone with this information and help them to continue spreading the no infection.
Yes, I love it. I love it. So because we want to move on. We want to move on, and we've got lots of things to do in this life. So thank you so much again. And for your time. We'll be talking soon, of course. Oh, and just to let people know, you and I we are in the process of creating a free ebook resource for people about our immune systems building up for times like this, but also for prevention, because that's what we love to look down the road. And we're going to have this available as a free resource for you all, but we're working on it now, so it's going to come together, and very soon we'll have that. So thank you for partnering with me on that as well.
Thank you, Andrea.
All right, so AndreaThompson.org, you can go to the website, check out the blood test, and you can also share this message, rewatch it if you did not take notes, and take lots of notes. Listen, even I still take notes, lots of notes. All right. I love you all. Love you, Dr. Hilu. You took notes too. You had your notes. That's right. All right. We'll see you guys. Bye-bye.
All the best, Andrea.
All the best. All right. Bye-bye.
Bye-bye, dear. Bye.